Namaskar. This is most likely going to end up being a two-part series. So the first part we're going to talk about is trauma to the tailbone, and we're going to assume that a person has either fallen backwards or fallen down somehow to where the sit bones themselves have impacted the ground pretty hard. When we think of tailbone, we think of the coccyx area, which is the very tail, where us who are primates, that includes gorillas and chimpanzees and orangutans, all being primates, that we have, that is the tail end of our tail. So we don't have tails like, say, monkeys, but that is the end of where our tail is, which is the end of the SI joints. Okay. Now, beyond this point, we have a student who has approached us and has problems from this injury. Now, she may say to us, 1 month has gone by and I don't feel any better. Okay, can you give me some yoga exercises to heal the area? There are a number of issues here. One is, what kind of instructions did this person get from her doctor before she encountered you? And if she didn't get any, maybe she should contact her doctor. 2, are any of the asanas, we'll discuss asanas in this case, that you bring about and make her aware of, are they going to help or hurt the healing process? So we don't want to be counterproductive, and we have to understand that too, when a joint is injured, whether it's trauma or gradual injury or something genetic, that we can't just strengthen the area like magic and the pain is going to go away. What we can do is help in relieving pain. It's nice if we also cross-reference with her and have a doctor involved as well, because then we know. But how will she know if anything's working anyway? Pain. If the asana that you recommend hurts, it's not working. If you recommend an asana and within a day or two there's some pain relief, we're talking about progress here. So it's a matter of which ones should we select. We're going to go over that in the next part with Marie and I, but I want you to understand that basically pain is the determining factor here. Understand that a joint might not heal in a month, 2 months, 3 months. Joints are not like muscles. Unfortunately, sometimes an injury to a joint may not heal over a lifetime. And with an area as sensitive as we've just discussed, and a lot of times you hear generically the word tailbone thrown out, could be any area. Some people are referring to their L5. But we'll just talk about the sacrum area. Now, when we consider the sacrum area, there's a lot involved here, as well as with the entire spine. We have nerves to consider. We have the structure of the spine itself. We have the fact that they are joints, and this is not muscle tissue. Muscle tissue is hard enough to heal. A 40-year-old person doesn't heal like a 30-year-old person. It's just 10 years difference is quite a difference. So with that said, the severity of the injury and the fact that it is to a joint and in the spinal area, it's going to take some time. How long do we think it might happen? We really don't know, and you'd be best off to have a doctor involved in this so that the doctor can give a professional opinion. My opinion, outside the medical community, would be we're talking months, and we're possibly talking longer. With that in mind, next week I'm going to come back with Marie, and what we're going to do is we're going to discuss a few options And we're going to show some modifications to postures that you're familiar with already, but we're modifying them for therapeutic application to stretch out the lower back and to work around the area of the sacrum, and we had mentioned the L5, L4 area in the lumbar region, that as well. I want to wish you a nice week. Om Shanti.